Eye infections, or ocular infections, as doctors may sometimes call them, can be common. But here's something you might not know. There are many different types of eye infections. And symptoms and treatments can vary widely depending on the type of infection you have. So, how do you know what to do for an eye infection? That answer is simple. Visit your eye doctor. When it comes to your eye health, it's always best to leave diagnosis and treatment planning to the experts. Although some eye infections may be mild and heal on their own, others can be serious, and may damage your vision if not promptly and properly treated. With that said, I have taken out the time to bring this video to you to provide you with general information about some of the more common types of eye infections. We'll cover all the bases, from causes and symptoms to treatment of these infections. So try to watch this video to the end, and do not skip any part of this video. So, how do you get an eye infection in the first place? An eye infection can be caused when harmful microorganisms get into the eye. A bacterial eye infection, for instance, occurs when bacteria enter the eye. Eye infections can also be viral, caused by viruses, fungal, caused by fungi, or parasitic, caused by parasites. Here are some examples of how these microorganisms might enter the eye. Through eye injury. Improper contact lens care. Poor eye, or eyelid hygiene. Recent illness not well treated. Sharing personal care items, like makeup, eye drops, or washcloths with an infected person. And lastly, through eye surgery. What are these various types of eye infections? Eye infections can occur in any part of the eye. They can happen suddenly, known as acute, or they can develop slowly and last indefinitely, known as a chronic eye infection. Let's take a closer look at some of the more common eye infections. Number 1. Conjunctivitis, a.k.a. pink eye. Conjunctivitis or pink eye is inflammation of the conjunctiva, the clear mucous membrane that covers the eye. Infectious conjunctivitis is most commonly a viral eye infection, but it can also be bacterial. It's also possible for allergies or irritants to cause conjunctivitis, but in those cases, it's not a contagious infection. Number 2. Stye. A stye is a type of eyelid infection. Specifically, it's an infection of an oil gland in the eyelid. The infected oil gland causes a swollen bump to form on the edge of the eyelid, or under its surface. Styes are most commonly caused by staphylococcal bacteria. A staph infection. Number 3. Blepharitis. Blepharitis is a common eye condition affecting the eyelids. It can cause dandruff-like flakes, or crust to form at the base of the eyelashes. This condition can be caused by clogged oil glands, excessive bacteria on the eyelids, or even microscopic mites that live in the eyelash follicles. Don't worry about the mites. We all have them. Some people just have more. Blepharitis isn't contagious, but it can be uncomfortable and is often a chronic condition. Number 4. Keratitis. Keratitis is inflammation or infection of the cornea. When keratitis is infectious, it can be bacterial, viral, fungal, or parasitic. This type of eye infection is often associated with contact lens wear. Microbial keratitis can occur when contact lenses aren't worn, or cared for properly. Number 5. Uveitis. Uveitis is inflammation of the uvea, the middle layer of the eye. The uvea includes the iris, the colored ring around the pupil, the ciliary body, which helps the lens to focus, and the choroid, a tissue that connects the retina to the sclera. Infectious uveitis can be viral, bacterial, fungal, or parasitic. Uveitis can sometimes be a chronic eye infection, meaning it can last long-term, and may be a result of a systemic condition. Number 6. Cellulitis. Cellulitis is usually a bacterial eye infection, but it can also be fungal. This is rare and usually occurs in immunocompromised patients. Two types of cellulitis that can affect the eyes are preseptal cellulitis and orbital cellulitis. Preseptal cellulitis is an eyelid infection, whereas orbital cellulitis affects the orbit, eye socket. Orbital cellulitis is a serious condition that requires immediate medical attention. The last one on the list is endophthalmitis. Endophthalmitis is an infection in the tissues or fluids inside the eye. The most common cause of endophthalmitis is bacterial infection following cataract surgery. Infectious endophthalmitis can also be caused by fungi. What are the symptoms of eye infections? Signs of an eye infection will vary depending on what type the infection is, and how severe it is. But generally speaking, I will name a few indicators to watch out for. What does an eye infection feel like? If you are experiencing or feeling the following symptoms I will mention, then you're at risk of an eye infection. Number 1. If you are always irritated or uncomfortable. Number 2. If you have watery or teary eyes. Number 3. If your eyes are sore or tender to touch. Number 4. If your eyes are always itchy. Number 5. If you have a gritty feeling, like something's in your eye. Number 6. If you feel a burning sensation. Number 7. If your eyes feel sensitive to light. Now that I have listed the possible ways you might feel if you have an eye infection, now let us go to what it might look like if you have an eye infection. What does an eye infection look like? If you have an eye infection, you might see the following signs. Number 1. A pink color in the white of your eye. Number 2. Crust, or flakiness on your eyelashes and eyelids. Number 3. Swollen, or red eyelids. Number 4. Yellow, green, or clear discharge. Anytime you experience eye symptoms, especially if your vision is impacted, don't hesitate to make an appointment with your eye doctor. Eye infection treatment. Is there any specific treatment for an eye infection? There's no one single solution for treating an eye infection. Treatment will vary widely depending on the type of infection and its severity. Some types of eye infections may respond well to home remedies like compresses or eye drops, but others may require antibiotics or prescription medications. It's important to consult with your eye doctor to ensure that you're following the best treatment for your specific situation. Thank you for watching this video. Please subscribe to this channel. Hit the bell icon, so that you will be notified anytime I post content on this channel. And please, share this video with family and friends.